Somatic exercises for anxiety, part 2. The following 3 somatic exercises for anxiety use the movement technique of pandiculation to release chronic muscle tension, relax the nervous system, and retrain the rounded posture triggered by the withdrawal response. First, we have arch and flatten. You'll come down to the floor and lie down on your carpet, exercise mat, or blanket. Before starting the arch and flatten movement, let's do a few minutes of diaphragmatic breathing. This exploration teaches you how to relax your abdominal muscles and allow your lower belly to expand as you inhale, allowing you to take a full breath. If this happens to be challenging for you, you can practice these 3 exercises regularly, and it will help allow you to release the tight muscles in the front of your body that are preventing you from breathing deeply. The arch and flatten is the most important clinical somatics exercise to do daily. It pandiculates the muscles of the lower back and abdomen, which are central to the postural reflexes triggered by stress. This exercise allows you to release tension and regain voluntary control of the muscles of the lower back and abdomen, stabilizing the core of your body and bringing your pelvis into correct alignment. Next, we have the arch and curl. The arch and curl is a bigger version of the arch and flatten. By lifting the head and shoulders off the floor in this movement, you engage the abdominal muscles more strongly, allowing for a greater release of tension. This exercise is important for anyone who has a rounded upper back, shoulders that round forward or rotate inward, or a forward head posture. In this second exercise of the arch and curl, called head lifts, this exercise releases the muscles involved in forward head posture. You can feel free to practice this movement as well. Third, we have the iliopsoas release. This is an important exercise for everyone to do regularly, as nearly everyone holds tension in their psoas major muscle. Due to its location deep in the core of the body, the psoas is at the root of most postural issues. The psoas also tightens up in response to stress or trauma. And as you release chronic tension in your psoas, you may notice emotions coming to the surface. It's important to practice this exercise gently and correctly And you'll see that there are 3 versions of this movement, each one increasing in intensity. Please only do the versions that feel comfortable for your body and don't force anything. It's very important to press your lower back firmly into the floor the entire time as you lift and lower your leg. Do not release the flattening of your lower back until you have lowered your leg all the way to the floor. The iliopsoas practice begins with the arch and flatten, which should be practiced as a warm-up before doing the iliopsoas release. Once you're comfortable with all 3 exercises, you can practice them in a sequence. The arch and flatten, arch and curl, and then the iliopsoas release. However, be careful to not overdo it. You may find that doing just 1 or 2 of these exercises per day is right for you in the beginning, especially if you have any type of chronic pain.